viewers, today I am going to be bringing one of the most common mental health disorder that exists among women after childbirth. It has been in existence for a very long time, but there is little or no awareness in the African society. So people just feel she is overdoing, or the woman who just gave birth is misbehaving. They feel you are not the first person to give birth. Why are you always tense? Why are you always angry? You too do. No, she's actually faced with a mental health disorder named postpartum depression. However, before I talk about postpartum depression, I am going to split it. I am going to define depression and I am going to define postpartum depression. Depression can be defined as a common mental disorder that exists among women, especially the first-time mothers. Depression can be defined as a common mental health disorder that exists in humans and which is capable of elevating or lowering the mood. It can also be known as bipolar disorder, or it is closely related to bipolar disorder because bipolar disorder has to do with mood swing. However, depression has to do with changing somebody's mood to persistent sadness. It can cause significant impairment in the person's way of life, in the person's sleep, and in the person's general existence. That is the definition of depression. However, postpartum can be defined as a stage in a woman's life which starts or begins from after childbirth to nursing and nurturing of the newborn, of a baby. Let's combine depression and postpartum together. Postpartum depression can be defined as the combination of depression and postpartum, meaning it is the combination of mood swing which has to do with elevating and lowering of the mood after childbirth. So bipolar disorder also exists in postpartum depression. Bipolar disorder has to do with mood swings, changing of mood. So bipolar disorder can be closely related as part of postpartum depression. Let's talk about postpartum psychiatric illness. It is categorized into 3 different categories. I am going to be listing them and I am going to be explaining them. Number 1 is PPB, that's postpartum blues. This is common among 80 to 85% of women few weeks after childbirth. It is said to be a normal depression or mood swing activities which exist among women within the few weeks after childbirth. It is safe to say it is not a psychiatric illness because after 2 to 3 weeks it fades away. So it is just described as a mood disorder, meaning it is described as a bipolar disorder which does not affect the way she reasons or the way she carries out her day-to-day activities. She will only be having mood swing. So this is a mild psychiatric illness. So number 2 is postpartum depression, PPD. PPD is an emergence over PPB because this exists in months. This extends to months. This can extend to as long as 2 to 3 months. It is quite higher than that of PPB because PPB just exists for weeks, while this can extend to as long as 2 to 3 months. However, during the existence of this, it brings room for a general anxiety disorder. I talked about general anxiety disorder in one of my previous videos that I talked about. Anxiety is a mental health disorder. Go and watch it, you understand better about general anxiety disorder. It affects the woman generally. Then the B part is postpartum obsessive compulsive disorder. This disorder has to do with the woman nursing the thought or the idea of harming her child and herself. However, this is a severe depression mood that should be taken seriously, that shouldn't be taken as a negligence. Parents or mothers or husbands, please take note of a woman that just gave birth and is faced with postpartum depression.
Oh my God. Oh my God, I can't do this! I can't do it! Oh my God.
but not the least category of postpartum psychiatric illness is postpartum psychosis. It is a rare but very common psychiatric illness. It happens to 1 to 2 per 1,000 women. However, it should be taken seriously because it is the most severe. This is a suicidal thought or a thought to kill or hurt a newborn. Under postpartum psychosis, it gives room for more bipolar disorder. Here are some signs to take note of. Number 1 is restlessness. Number 2 is irritability. Number 3 is insomnia. When you notice these signs are consistent in the woman and you don't see signs of it reducing, please take her for a therapy. That is a postpartum psychiatric illness that is already in your wife or in your daughter. Under postpartum depression, we are going to be talking of some signs to look out for. So mothers and husbands, if you notice this sign in your daughter who just gave birth or in your wife who just gave birth, please take her for a therapy. Number 1 of the sign is sadness. A woman who just gave birth is going to be very excited to see her offspring. But when you notice that the reverse is the case, she's not excited, she's sad, that is a sign of postpartum depression. Number 2 is tearfulness. When you notice she's always crying. Somebody who just gave birth is supposed to be excited, but instead she's crying. That's another sign you should look out for. Number 3 is withdrawal from regular activities. She doesn't want to be involved in whatever she likes doing. You are trying to cheer her up, you're trying to gist with her. Maybe she's the type that loves gisting, that loves playing game. She's less interested in it. That is another sign you should. Another sign you should look out for is feeling of guilt. When you notice she's feeling guilty, feeling of guilt can come in diverse ways. For instance, if she's finding difficult to get breast milk to feed her child and she's not happy about, she's feeling, I'm not a good mother, why can't I breastfeed my child, why can't I be like other mothers, or probably a child is faced with a disorder or the child is a special child and she's feeling she wasn't a good mother enough, or probably she must have done something to have gotten this kind of child. That is another way or another reason why she is depressed.
I know I'm such a mess right now. We just got home from his 2-month appointment and it went really well overall.
Number 5 is feeling of worthlessness or incomplete. She might be feeling she's not complete because she couldn't give her husband a particular gender, or she might be feeling she's incomplete because she has lost her body shape, her body look, and she's no longer attractive to her spouse.
I post it. I just want anyone who's going through what I'm going through to know that it's going to be okay. That even though we love our babies, but we're going through this, I don't want anyone to feel like they're alone, because I kind of feel like I am. But I know that mamas have gone through this and made it out the other.
Number 6, we have fatigue. That is a strong desire to sleep or feeling of tiredness. When she's exhausted, she's tired. That is another symptom you should look out for in your wife or in your daughter. 7 is sleeping disruption. That is when she's constantly disrupted during her sleep. They are constantly waking her up. Your baby is crying, your baby needs breast milk, and please, where can we get this? Please, how can... At that time, she doesn't need all those disturbances. All she needs is rest. That's why we advise that we invite her parents or in-laws or help to assist during that period. Number 8, we have change in appetite. You realize that she doesn't want to eat. Every time you ask her to come and eat, she says she's not hungry. She has lost her appetite. That's another change in appetite. That's another sign you should look out for in her. Number 9, we have poor concentration. You are talking to her, you are having some conversation with her, and you discover she's lost. You'll be like, where have you been? She'll say, sorry, what were you saying? Come again. That is another symptom you should look out for. And number 10 is suicidal thoughts. When you notice your wife is telling you that I just want to kill myself, I am tired, this baby is disturbing me, I feel like killing this baby, or I feel like even killing myself, I even want to rest. That is another sign you should look out for as a spouse, as a parent.
When having a baby gets easier,
because the newborn phase is so hard. I feel so guilty for feeling this way, but I can't help it. I don't even have my baby right now. My mother-in-law took him for the night so that I can have a break, and I'm sitting here on my night off crying because I am so anxious, and I am already anticipating having to pick him up tomorrow and just do it all again. And he is so miserable 24/7 right now, and it scares me. Like, I'm actually scared of my baby. I'm sitting in bed trying to relax, and my like jaw is clenched, my fists are like closed, like I can't, my body is in like fight or flight, like 24/7. I am, when does this end?
We are going to be talking of the causes of postpartum depression. Now let's look at the causes of postpartum depression. Number one is genetics. Probably one of your family or your relative once had postpartum depression after childbirth. You might have it. That is another cause of postpartum depression. Number two is physical changes. The drop of hormonal estrogen in your body can cause postpartum depression. Number three is emotional issues. Emotional issues in the sense that probably you are overwhelmed and you lack rest. That can cause postpartum depression. And another reason why emotional issues can come to play is probably you have an impaired child, or you gave birth to an impaired child. That can disturb you emotionally, causing emotional imbalance, and you will not be able to handle minor issues effectively. Now let's look at the risk factor of postpartum depression. Risk factors are those things that predisposes one to postpartum depression. Meaning, risk factors are the things that will make you have postpartum depression. Let me use the layman English. Number one is genetic history. Probably you have somebody that once had postpartum depression or mood disorder in your family. You are at risk of having postpartum depression. Number two is depression history. Probably you as an individual, that's the woman herself, she was once depressed, or she has been depressed even before she gave birth. That means it is very easy for her to even go into postpartum depression. Number three, bipolar disorder. Probably as an individual, you have bipolar disorder before childbirth. So after childbirth, it is very easy for you to go into postpartum depression. That's another risk factor of postpartum depression. Number four, we have history of previous pregnancy. Probably during her previous pregnancy, she once had pregnancy complication, illness, or pregnancy miscarriage. She might go into depression because of fear of how to nurture or care for her newborn. So she might feel, oh, I am not being a mother. That self-worth might be lacking in her. That can prompt her into going to postpartum depression. And number five is baby's health. I talked about it before now. I said the baby's health of the child can determine if the mother will go into depression. If a woman has a special child or an impaired child, that can affect her emotionally, and that can lead her into postpartum depression. Number seven, we have numbers of baby. If a woman gives birth to twins or triplets and so on, and she's not financially capable to take care of them, that can lead her straight into postpartum depression. And the next number is problem in relationship or marriage. Probably she and her boyfriend or she and her spouse are not in cordial relationship. They are having issues in their marriage or issues in their relationship. That can lead her straight into postpartum depression, because she's going to have fear of, she's going to nurse the fear of how is she going to cater for this newborn. Number nine, we have weak support system. Probably after childbirth, she doesn't have somebody to support her with her house chores, somebody to help her run few errands. She's left alone, she's on her own, and her spouse is not enlightened on how to cater for a woman who just gave birth. Her spouse is feeling, after all, my mother nursed 10 children, you should be able to nurse just 2 kids or just 1 child. And she has weak support system. It can lead her straight into postpartum depression. Number 10, we have financial problem. When a woman is financially struggling, or her spouse doesn't have money and she herself doesn't have money, it can lead her straight into postpartum depression. Number 11, we have unplanned or unwanted pregnancy. Probably she's not ready to be a mother, or she doesn't even want to give birth at all, or in her mind she has finished giving birth and the pregnancy come into existence. After childbirth, she can go into depression. Do you know there are ways to prevent this postpartum depression? If you are not aware, come, let me inform you. Number 1, talk to a professional. That's, talk to a therapist. You can talk to a counselor, you can talk to a psychologist. Just talk to either of these therapists and you will feel relieved. Number 2 is join a support group for new parents. There are some NGOs, there are some support groups that enlighten women, that help women to be more informed, to be more aware of their expectations after childbirth, so they don't go into depression. So join those groups. Don't just sit at home and hold on to yourself. Number 3, it is called prioritize rest. That means make rest your priority. Ensure that you rest, you have enough rest. Sometimes when you are being discharged from the hospital, you don't have to announce that, oh, they just discharged me. Rest first before you announce that you are being discharged. And number 4 is self-care. Endeavor to give yourself that baby girl treatment. Take care of yourself. Rest. That's why it's encouraged that you get support system, somebody that can help you with your own chores. 5, if you are an extrovert and you are not an introvert, after childbirth, don't just all of a sudden become an introvert because you just gave birth. Ask your spouse to take you out, sit out with friends, talk to friends on phone, make video calls, chat. Don't just sit at home and expect that you don't go into depression. That's part of the way to avert depression. 6, get help. If you don't have mother to come and do that omugo, or you don't have in-laws to come and do the omugo, or you have in-laws that are around that are not doing the omugo as they ought to do, please talk to your spouse to get a help for you that will help you with it. You actually need somebody that can help you with your house chores. If not, you'll be overstressed and overwhelmed and you will end up going into depression. The next number is limit the number of visitors you attend to. You cannot attend to all the visitors that are coming to greet you that, oh, congratulations, you just gave birth. You can't attend to all of them. Once you are tired and you are exhausted and you need rest. When the visitors come, they are going to tell the visitors that you are asleep. Let's go into diagnose. Let's look at people that can diagnose that you have postpartum depression. Number 1 is your obstetrician. That's the doctor that treats or deals with pregnant people. Number 2 is pediatrician. That's the doctors that deals with infants. That is when the person sees how you are nursing your infant and question you, that person can know that, oh, this person has postpartum depression. Number 3 is your mental health provider, which has to do with the counselor, of course, your psychiatric doctor, and your psychologist. People who can treat postpartum depression. Number 1 is a psychiatric. Number 2, your mental health provider, which has to do with your counselor or your psychologist. Let's go into the treatment of postpartum depression. Number 1, when a psychiatric doctor is to attend to you, it treats you with A, psychoeducation, B, psychotherapy. Number 2, when your therapy is to treat you, or your psychologist, your counselor is to treat you, they make use of A, cognitive behavior therapy. 2, support group. Like I said, join a support group. Number 3, we have medications. That is SSRI. There are several medications under this SSRIs. There are several. Your health personnel is going to give you in details those medications. Number 4, which can be adopted by both your psychologist, your counselor, or your psychiatrist, is lifestyle drugs. That is exclusive relaxation techniques. We are going to be talking about the refusal to treat postpartum depression. Meaning, when you refuse to treat postpartum depression, when you notice your wife or your daughter is faced with postpartum depression and you refuse to treat it or you shy away from it, here as the result of the refusal to treat postpartum depression. Number 1, we have continuous postpartum obsessive compulsive disorder. that is suicidal thought and the thought to harm her baby. She continues to think of it, and one day she's going to make use of those thoughts. So if you refuse to treat your daughter or your spouse who is suffering from postpartum depression, she herself is at risk, and the newborn is also at risk. Number 2, she continually suffers from other mental disorder such as bipolar disorder, conduct disorder, anxiety disorder, other mental health disorders. She continues to suffer them. Apart from this postpartum depression, she faces other mental health disorder. Number 3, we have low self-esteem or body shaming. She develops low self-esteem if you don't treat that postpartum depression, and she begins to start body shaming herself. She starts feeling, my body used to be fine, I don't used to have stretch mark before, but immediately I gave birth to this child, I started seeing stretch mark. My breast started sagging, my body is no longer firm, my body is now somehow watery, sagging. That is another symptoms or the result of the refusal to treat postpartum depression. Number 4, which is the next number, she has no or low ability to make an healthy and informed decision. Because she's faced with postpartum depression, it affects her logical way of reasoning. She cannot reason effectively. So when you refuse to treat that postpartum depression, she becomes totally dependent on somebody's ideas or thoughts. She cannot effectively manage her own thoughts and effectively take healthy and informed decisions. Number 5, refusal to treat postpartum depression also affects the baby, because the baby wouldn't get the needed care and nurturing from the mom. Because the mother is faced with postpartum depression, the mother might even be nursing postpartum obsessive compulsive disorder in her. So the baby is at risk. Secondly, the mother is not going to be emotionally, psychologically balanced to even nurture the baby. So when you refuse to treat postpartum depression, you affect the mother and you affect your child. So as a parent, if you notice your daughter is faced with postpartum depression, refusal to treat postpartum depression affects your child and affects the baby, your grandchild. And as husband, refusal to treat postpartum depression affects the joy in your home, and affects your wife, and affects the baby, and affects even you as an individual. So please, when you notice your wife is faced with postpartum depression, please, treatment is very essential. And if you are new here, please don't forget to subscribe to this channel. And if you need any counseling service, we are available for counseling. Don't forget to make a booking with us now. Bye-bye.
Postpartum is hard. Being a mom is hard. Postpartum is hard. Breastfeeding is hard. Pumping is exhausting. This is a reminder that your mental health is very important. I want so badly to give up when it comes to breastfeeding, but I don't want to give up because I want her to have the best. Being an overproducer is exhausting. I'm just here to say that I am tired. My husband has been amazing. He is my biggest support system right now. But I'm tired. And I'm trying my absolute best. And I don't want to feel like a failure.